For decades, federal spending on healthcare has been a little bit of a third rail in American politics. You know, the rail on a subway. We have so many of those in Nevada that when you touch it, it electrocutes you. But what happens to Nevada if Congress decides not just to touch the rail, but to grab it with both hands? From Battle Born Progress, this is Battle Born Bytes. My name's Jacob. Let's boogie. You know what? Let's keep that. That seems fine. So I'm going to be super real right now and say that Medicare and Medicaid have a ton of history, over 100 years in fact, so I'm going to give you the simplest version of this humanly possible. But to start, we do need a little bit of historical context. The idea of government healthcare or healthcare from the government goes all the way back to the early 1900s. That's when Teddy Roosevelt actually campaigned on a national healthcare program in 1912. That doesn't actually go anywhere, though. He obviously didn't win in 1912, where all my Bull Moose party heads at. It's not until 1935 that we see the first true social program in the Social Security Act of 1935 under Franklin Delano Roosevelt, FDR. However, under the original Social Security Act, healthcare notably missing. That's because of a lot of complicated 1935 political reasons that I'm not going to get into right this second, but it's another 10 years and another world war before an actual policy materializes under President Harry Truman in 1945. That's when he calls for a universal national healthcare program. However, it was actually 1945, and America was entering Red Scare mode. Because of that, the American Medical Association, which at this point had for decades opposed a national healthcare program, started likening it to socialized medicine, and everyone called it a little bit communist. This killed the program for 20 years, until 1965, that Congress finally passes the Medicare and Medicaid amendments to the Social Security Act under President LBJ. LBJ was actually so excited for Harry Truman in particular that he did the bill signing at the Harry S. Truman Library in Missouri, and here's a fun fact for you, gave Harry Truman and his wife Bess their very first Medicare cards. I just think that's neat. Okay, so now the US has government health insurance for seniors, Medicare, and for low-income Americans, Medicaid. But how does Medicaid actually work? Okay, again, this is mega simplified, but here goes. Medicaid fundamentally is the federal government saying, okay, here's the ground rules for how you're going to cover all these people and the loosest threshold possible for who's going to qualify, but it's up to the states to actually administer the program with mostly federal dollars and a little state dollars. But it turns out leaving this stuff to the states means you get wildly different Medicaid programs in practice. For instance, those guidelines include excluding able-bodied adults from Medicaid or even lowering the threshold to qualify for Medicaid below the federal poverty line. That's why in 2010, the Affordable Care Act, Obamacare for anyone who remembers 2010, tries to change this by creating the Medicaid expansion. Essentially, under this framework, anyone making 138% or below of the federal poverty line would qualify for Medicaid, and the federal government would match 90% of the cost of these new enrollees for the states. However, in order to incentivize states to actually do this, the way the ACA was originally written would have removed Medicaid funding from the federal government from states that didn't switch to the new guidelines. This goes all the way to the Supreme Court, where the conservative majority, as you may be surprised to find out, says, no, you cannot do that. We have decided that you cannot do that. So the Medicaid expansion at this point becomes opt-in, and a lot of states choose not to opt in. A lot of red states, but not Nevada, which becomes the first state with a Republican governor to opt into the Medicaid expansion in 2014. Since then, a bunch more states have joined suit, and now there are 41 states and Washington, D.C., who have expanded Medicaid under the Affordable Care Act, covering about 20 million new Americans. Now, here's the deal. Data from those states shows that the uninsured rate in expansion states has dropped dramatically compared to states that still haven't expanded Medicaid. For instance, in 2021, the census found that the uninsured rate in non-expansion states was 12.7%, almost twice as high as 6.6% uninsured rates in expansion states. Why do I tell you all this? Well, it's because Congressional Republicans have been seriously considering dramatically scaling back Medicaid, specifically getting rid of the expansion. But what would that actually look like? There's a couple specific proposals rolling around, but the big one is a proposal that would get rid of the 90% match from the federal government for new expansion enrollees in Medicaid. That's a lot of words. What does that mean? It essentially means the federal government would no longer match 90% of the cost of the Medicaid expansion, forcing states to either pay for it themselves or just get rid of people who joined Medicaid under the expansion in the first place. To put a big number on this, the Kaiser Family Foundation released a big report this week that tried to put a number on what this would look like from state to state. So in that report, in Nevada, if they were to get rid of all of those enrollees under the 90% match, we're looking at potentially 312,000 people who no longer have health insurance, out of 800,000 people in Nevada who are enrolled in Medicaid today. Democrats in Nevada's state Senate are already pressing Republican Governor Joe Lombardo on exactly what this would mean for Nevada if we see these Medicaid cuts come to fruition. But in the meantime, I spoke to Senate Majority Leader Nicole Cannizzaro to get a sense of the scale of what we're talking about here and how it could affect Nevada's budget.
We as a state have approximately a little over a third of our budget is federal funding. A significant portion of that is Medicaid dollars that are coming directly in the state to provide services to families, to children, to our elderly populations, to Nevadans throughout the state, rural, northern, southern. Suffice to say that even if we were to lose some of those ACA expansion FMAP dollars, we are looking at, I believe they said it was about a $1.858 billion with a B dollar hit in terms of funding to the state of Nevada. Those are real services. Those are real Nevadans that are going to find themselves without health care because we don't have, $1.8 billion sitting in our budget to make up that difference.
More broadly, I asked Senator Cannizzaro if there was a world in which Nevada could even afford to keep all these people on Medicaid if those reimbursement rates were cut.
No. That money does not exist in our state budget. We as a state are pretty lean when it comes to government spending. We don't have a sizable amount of government. We have a significant portion of what our state spending is and what it goes towards is healthcare and education. So making sure the kids can get a good quality education and making sure that they have access to a variety of different healthcare services across the board. There is no other place in state government where we can just go in and simply cut a program that is going to give us, hundreds of millions or billions or over $1 billion. That just does not exist here in Nevada.
I also wanted to find out what this would mean for Nevada's broader economy and bigger budget, because, as Cannizzaro will say, about a third of Nevada's money comes from the federal government.
There is no situation where we are going to be in a position that this wouldn't affect the rest of the budget, right? We know that Medicaid funding provides critical services that we are either, I think to your point of what effect does this have on Nevadans? If you take your child to the doctor because they are sick and you are told that you must pay an out-of-pocket expense, right? You have to pay that cash for that visit and oftentimes pay that cash in order to see the doctor for whatever might be wrong with your child. If you are covered under Medicaid and that is no longer available to you, there is no other place to go to buy health insurance. But folks who are on Medicaid do not have that extra money to be paying high subsidy plans or high deductible plans. Providers are going to have a harder time staying here in Nevada and continuing to provide services to everyone else, right? Because a lot of our healthcare market, these insurers, these providers who are providing the healthcare services to everyday Nevadans. If you have health insurance, for example, through your employment or through a spouse's employment, those practitioners are often also seeing Medicaid populations. Insurers are also covering Medicaid populations. And so for them to also lose all of that, it's going to make it a lot harder for us to continue to have access to providers, no matter where it is that you're getting insured from.
And that was just a portion of our interview with Senator Cannizzaro. If you want to watch the full thing, where we get into stuff like the budget or IVF, you can watch it linked up there or down in the description. But for now, we're still waiting to see what Medicaid cuts might actually look like. So the state and everyone on Medicaid is stuck in limbo. Like the big title card says, there's just so much news, and we are all but creatures of the flesh, spinning on a giant rock, hurtling through time and space, spiraling towards the heat death of the universe. So I have condensed some headlines for you. First, some legislative quick hits. We got a bill this week introducing protections for in vitro fertilization, IVF, big topic in the news, plus a couple of bills that would create massive tax credits for film studios in Nevada, which, okay. Second, quick egg update. The USDA fired a bunch of people working on controlling the bird flu and then is now struggling to rehire them. Again, file under oopsie daisy. And finally, in related news, the Las Vegas Review-Journal reports that Nevada's only national park, Great Basin National Park, fired 20% of its workforce over the weekend as part of a national purge from Elon Musk's Doge agency. Those firings hit national parks across the country and in the U.S. Forest Service and Department of the Interior. But that does it for today's episode of Battle Born Bytes. We want to thank Senate Majority Leader Nicole Cannizzaro for joining the show today. If you like Battle Born Bytes, be sure to like, subscribe, and hit the bell to make sure that you're notified when we get a new episode. But until next week, from Battle Born Progress, this has been Battle Born Bytes. We'll see you next week.